Hello, and welcome to our module on Welcome to Medicare 2024, Module 7, Low Income Assistance Programs. With costs so high, many people on Medicare with limited incomes find it hard to pay for medical and prescription costs. Fortunately, there are programs to help people pay for these costs, and this module will give you an overview of these programs. My name is Diane Whaley, and I'm with Contra Costa HICAP. HICAP stands for Health Insurance Counseling and Advocacy Program. This is part of a nationwide network of programs endorsed by Medicare to help people with all things related to Medicare. We do education, individual counseling, and advocacy for folks who have Medicare or who will soon be eligible. It's a volunteer-based organization, and our volunteers undergo extensive training, initial and ongoing, and we're all registered with the California Department of Aging with strict guidelines on what we can and cannot do. We get some funding from the federal government and also from the state. The best part for you is we have no affiliation with any insurance companies or other companies that sell Medicare-related products. Our counseling is entirely objective, and we are only interested in helping give you good information so you can make good decisions. Here's an outline of the programs that we're going to be touching on in this program. Some of these terms may be a little strange, but hopefully by the end of the program, it will mean a little bit more to you. We'll be talking about the transition from expanded Medi-Cal, also called Magi Medi-Cal, to Medicare. We'll be touching on Medi-Cal programs that apply to most people who are eligible for Medicare. The principal one being the Aged and Disabled Program. FPL stands for Federal Poverty Level, and this sets the income level for people who may qualify for this program. We'll be touching on Medi-Cal with a share of cost, the 250% Working Disabled Program, a program called QMB or QIMBY for Medicare Part A, and we'll also touch on extra help for prescription drug coverage. The Affordable Care Act of 2010 allowed Medi-Cal to provide health coverage to many people between the ages of 19 and 65 who did not have other coverage. Many of these folks are insured by qualified health plans offered by Covered California. Persons with incomes below a certain threshold, and it is 138% of the federal poverty level, are automatically covered by a special expanded Medi-Cal program called Magi. Now, when I said automatically covered, I mean if you have applied for coverage under the Affordable Care Act and your income is below that threshold, then you will be placed in the Magi Medi-Cal program. Magi stands for Modified Adjusted Gross Income, which is the income tax level that qualifies someone for this program. And persons who qualify for Magi Medi-Cal receive their health coverage and their prescription drugs through Medi-Cal at no cost. Once someone turns 65, however, Magi Medi-Cal coverage ends, and even if you want it to continue, it can't. So it's important that everyone who's eligible for Medicare signs up timely for Medicare. Most folks who have been covered by Magi Medi-Cal will now also be eligible for another Medi-Cal program called the Aged and Disabled Medi-Cal program. So in this case, When your Medi-Cal program ends at age 65, sign up for Medi-Cal, and in most cases, you'll be able to transition smoothly to have the aged and disabled Medi-Cal program, and then you will have both coverages, Medicare and Medi-Cal. It's important to do this transition to Medicare timely, otherwise you will not have any prescription drug coverage. Once you reach age 65, Medi-Cal stops covering your prescription drugs. We can help with this transition, and we also have a fact sheet that gives you information on making this transition. Now we're going to talk about some other Medi-Cal programs. Because of recent changes in California law, the Medi-Cal program is now the easiest of the low-income programs to qualify for, and the best news is it provides the greatest benefits. Medi-Cal is California's name for what is called Medicaid in other states. This is a combination of federal and state programs to provide benefits to persons with limited incomes. And of all the low-income programs, this has the highest income limit. In other words, more people can qualify. No asset limit, and it does offer the most benefits. Medi-Cal, a big program, has many programs, more than 200, but most people who also have Medicare are in the aged and disabled program. And we call folks who have both Medicare and Medi-Cal dual eligible. You get both programs. And so we call these folks duals for short. If you are disabled, under 65, or 65 or more, and your monthly income is no more than $1,927 a month for a single individual, or $2,722 a month for a married couple, you may qualify. Now, note that these figures do include automatic deductions by Medi-Cal. The figures that Medi-Cal publishes about this are a little lower, but we know that Medi-Cal always takes certain deductions from your income. So actually, the higher income in most cases will qualify you for Medi-Cal. So what's counted as income? Any Social Security benefits that you're receiving, income from other non-work sources, such as pensions, investments, rentals, alimony, and so forth. Note that if you are working, slightly less than half your work income is counted. This is good. And, again good, effective January 2024, assets are no longer counted. If you meet these criteria, you will likely qualify for what is called full scope Medi-Cal. These are all of the Medi-Cal benefits, and they are considerable. It's a great program. The state will pay your Medicare Part B premium, and if you're responsible for any late enrollment penalties, it will pay those penalties as well. You will not be responsible for Medicare copays and coinsurance in most cases. Without having to apply separately, you're automatically eligible for extra help, also called the low-income subsidy, for your prescription coverage. And of all the different groups, you will pay the lowest monthly copays for meds that are covered by your drug plan. You'll pay only $1.55 a month for generic drugs and $4.60 a month for brand drugs, no matter how expensive the covered brand drug is. You will be eligible for drug plans that have no premium, or if those aren't a particularly good fit for the prescriptions that you're taking, you will be able to get other drug plans at a significant discount. You also have the right to change your drug plan once a quarter through the third quarter of the year. Also, you will be eligible for some special Medicare Advantage plans that are designed for dual eligibles, people with Medicare and Medi-Cal. And these are especially designed to meet the needs of people who have both Medicare and Medi-Cal. And just as with the drug plans, you have the right to change these plans once a quarter through the third quarter of the year. Here's a big one. If you are approved for in-home supportive services, those costs will be paid by the state. That can save you thousands of dollars a month. Other benefits are also included in full scope Medi-Cal, including Denti-Cal, coverage of non-Medicare covered supplies, for example, incontinence supplies, transportation, and many other benefits are included with full scope Medi-Cal. For details on Medi-Cal and how to apply, go to our website and cchicap.org, and we have a very helpful handout called Medi-Cal Facts for Seniors, and it describes the program and the benefits, and it tells you how to apply. Now, some folks who enroll in Medi-Cal have incomes too high to qualify for full scope Medi-Cal with all of its benefits, and they will not receive the excellent benefits that I have just been describing. They'll technically have Medi-Cal coverage, but they won't be able to access the full scope Medi-Cal benefits because they're approved for Medi-Cal but have what's called a share of cost. A share of cost, that term is confusing to many people. It's like a monthly deductible. One never pays a share of cost. But how it works is if you have high out-of-pocket costs in a month, Medi-Cal will only pay for medical expenses that month that exceed the share of cost limit. And it's also true, as I mentioned, that you will not have access to all the benefits that a full scope Medi-Cal beneficiary would. But the good news is it is sometimes possible to eliminate the share of cost, which means that you then will have the full scope Medi-Cal benefits. We have a handout on our website that describes the share of cost, what that strange term means, how it works, and how in some or many cases it's possible to eliminate that share of cost and then receive full scope Medi-Cal benefits. Another program can be an excellent way for certain individuals to obtain full scope Medi-Cal benefits. And these folks would qualify because they are or have been on some federal disability program, most often Social Security disability. So if you were on Social Security disability, if you're on it now or were when you turn 65, you will likely be eligible to be considered for this program. The excellent part of this program is that the income that you get from disability or that was previously considered disability income before you turn 65, this income is not included in the countable income calculations that Medi-Cal makes. So that means that a huge amount of your monthly income is excluded by Medi-Cal when they're considering your eligibility for the programs. In order to qualify for this program, not only must you have had some disability or be on disability now, but you must do some kind of work. And when we tell people about this program, they sometimes say, "Oh, you don't understand. I'm disabled. I'm seriously disabled. I can't work." But the wonderful part of this program is even doing the simplest work may qualify someone for this program. You may be looking after your grandchildren, or you may be doing some helpful things for a neighbor, or something as simple as making phone notifications to a family member or a friend uh, may qualify someone for this program. The income limits for this program are much higher than for aged and disabled Medi-Cal, which means that if you do have another kind of job, you can earn more. And if you're approved, you will receive those wonderful full scope Medi-Cal benefits. So you'll want to know more about this. For details on this program and for information on how to qualify, go to our website, cchicap.org, and look at our handout on the Medi-Cal Working Disabled program. If you can qualify, I think you'll find it's a wonderful program. Two other programs may also be helpful for certain individuals who have low incomes. And one is the QMB program, what we often call QIMBY, commonly called QIMBY. This is one of 3 Medicare savings programs, but we're not going to talk about the other 2 programs because it's actually easier to qualify for full scope Medi-Cal, and full scope Medi-Cal provides more benefits. But the QIMBY program, QMB, does something no other program does. It's the only plan that will pay the Part A premium if you have inadequate work credits based on your own or your spouse's work record. So if you don't have Part A and your income is low, perhaps you will qualify for the QIMBY program. Once you do qualify, other benefits that are included are that the Part B premium is paid and including any late enrollment penalties. You're automatically eligible for extra help, also called the low-income subsidy, for prescription drug coverage, and no copays or coinsurance are allowed for Medicare-covered services. But note that of all the programs that I'm discussing today, QIMBY has the lowest monthly countable income limits. $1,255 a month for a single individual, or $1,703 a month for a married couple. For details on this program and how to qualify to have your Part A premium paid, again, go to our website, cchicap.org, and check out these 2 handouts. The final program I'm going to talk about today is Extra Help for Prescription Drug Coverage, commonly called LIS, or the Low Income Subsidy. Of all the programs that I'm mentioning today, this is the only program that is a federal-only program. The other ones that I've described so far are receive both federal and state funding. This provides savings on the premium and the copays for your Medicare Part D coverage, whether you are in a separate Part D prescription drug plan or are in an Advantage plan with drug coverage. And because it is federal only, of all the programs mentioned, this is the only one that still has an asset limit to qualify. In order to qualify for this program, your monthly income must not exceed $1,903 a month for a single individual, or $2,575 a month for a married couple. And your assets must not exceed $17,220 for a single person, or $34,360 a month for a year for a married couple. So these asset figures are, of course, for the year. Note that the house that you own and live in is not included as an asset, nor is one car or your personal property. If you own a house that you don't live in and perhaps are renting it out, that house would be considered an asset. But if you own a house and live in it, that is not counted as an asset. To qualify for this program, which only helps with Part D drug coverage, but it provides very good help, you need to apply at the Social Security website, ssa.gov. Now, note that if you have qualified for any of the programs that we've previously mentioned, then your extra help coverage is automatically included, and you do not have to make a separate application. But if you have not qualified for any of those other plans, then you should go to the Social Security website and apply there. And this handout provides information on how to do that. So this has been a brief overview of the state and federal programs that may help you save money. I've mentioned many times our website that gives you more information. And if you have further questions or want help enrolling in any of these programs, you can contact us. Again, our website is cchicap.org. We have an email address that you can reach us at, and many people call our phone number 925-655-1393. Note that we do not have staff to take calls live, so you'll need to leave a message. Our volunteers will call you back to determine what kind of help you need and work with you to figure out what's the best way to get you the counseling help that you need. So thank you for viewing this module. I encourage you to explore the other modules that we have.